Hello, my name is Stefan Voicu from University Polytechnica of Bucharest, and I will present you our invention related with dialysis membranes with the ability of controlled release of active substances for the concomitant treatment of chronic renal dysfunction and liver cancer and the procedure for obtaining it. First of all, something related to membranes. A membrane is, by definition, a selective barrier that permits the separation of certain species by combination of sieving and diffusion mechanism. And the term comes from the analogy with the biological cell membrane, and we can observe in the structure of the polymeric membrane the same as in the case of cell membrane. Why membranes for medical applications? Because except heart and brain, all our organs have a membrane function. So we have technical replacements for kidneys, for lungs, and for liver, which is the most complex membrane factor. What is chronic kidney disease? Very simple, the kidneys are not working. The main symptoms are related with energy loss, dyspnea, and urine problems. The main causes are related with diabetes, hypertension, and pollution, and the treatments are related with hemodialysis or renal dialysis. Kidney disease stages. There are five stages from 1 to 5, and this is related with the ability of kidneys to filtrate blood in milliliters per minute. So the normal value is higher than 90 milliliters of blood per minute filtered by the two kidneys, and at a value less than 15, we are speaking about chronic kidney disease and the hemodialysis. This is the schematic representation. So the blood is removed outside the organism and recirculated for 4 hours once at 2 days and filtrated by a membrane. This is the simple way. This is the real way. The machine is very complex with many mechanisms of technical feedback, sensors, pressure regulator. So the polymers for hemodialysis modules. So initial researches started from cellulose derivatives at the beginning of 20th century, and the most common used polymer today is polysulfone. Our invention is related with a polysulfone membrane with the ability to filtrate the blood during hemodialysis procedure and on the same time to release doxorubicin in the blood during this medical procedure. Why? Because approximately 20% from the patients with chronic kidney disease will develop during their lifetime a form of liver cancer due to the high concentration of toxins in their blood. Basically, our invention proposed the synthesis of some supramolecular architectures based on cyclodextrins, and in these supramolecular architectures, we entrapped doxorubicin, and more than that, these supramolecular architectures are functionalized with monoclonal antibody for alpha-fetoprotein. Alpha-fetoprotein is the tumor marker for liver cancer. So during the hemodialysis procedure, depending by the concentration of alpha-fetoprotein in the blood, these supramolecular architectures will be broken and the cytostatic uh, drug will be released, making on the same time the treatment for liver cancer and the filtration of blood during hemodialysis. Finally, I would like to acknowledge my colleagues who work with me on this invention and the financial support provided by Executive Agency for Higher Education, Research, Development and Innovation Funding. Also, to thank you for your attention.